So now you'll watch the surgery, you'll see the technique being done live, you'll see how everything flows just the way we planned it. Here's my surgical guide, fabricated from CEREC from the GALILEOS planning. Now, what I'm going to do is I've relined it with registration material prior to the scan, and then we scan the patient with what's called the bite plate. And they retrofit the bite plate into the surgical guide, and here you can see the master cylinder from 3i. So what I'm going to do now, and I always check, is just verify the fit. And we can take a look here and see that we have, you okay, Ron? Okay. We have good stability and everything fits extremely nicely. So when we go to do the implant placement, we don't have to worry about the guide wobbling around. So again, we're going to take a look at the tooth. We can see what we have, where the tissue is, and our goal is to try to remove it atraumatically, preserving the tissue and the bone. So what I use are these instruments called proximators from Carl Schumacher, and they're just used to gently expand the site. So what I'm doing here is slowly working down the PDL. And I start on the mesial and the distal. And they have one for each side. And again, this is the most important part, so we make sure we take our time. Skinny elevator. I've got a little bit of movement. And then what I like to use from Carl Schumacher as well section is an apical retention forceps. And try to grab apically, get a hold of the tooth, and gently, just like we're taught, rotate, gently expand, rotate. Very light buccal lingual movement. Rotate, rotate, and there we go. Now we've atraumatically removed the tooth root. Now what I'm going to do is gently curette the socket. What I'm trying to do is stimulate the bone to bleed, and I'm also making sure we remove any tissue and minor infection that he may have. Okay, and then we just take some sterile saline and flush out the socket. So now we have a tooth taken out atraumatically. Everything is nice and intact.